This video focuses on smaller animals, specifically dogs and cats, and covers the basic wound techniques for wound care and bandaging. Beyond the basic first aid principles, there's a skill where science and art are combined.
You may know the principles of wound care and bandaging, and that's the science part of it, but the art is really in developing a feel for using and applying the materials. Treating wounds and bandaging are not completely benign acts. You can make an injury much worse with incorrect wound care or by improperly applying a bandage.
An improperly placed bandage can be worse than no bandage at all. This is an area where practice makes perfect.
It's a good idea to get supplies and animals to practice on so you can develop a feel for the materials in a non-urgent setting. Having this familiarity will be very helpful when you need to do first aid in the field. So as we look at an injured animal, the first step is to evaluate the wound. Is it bleeding? Are any internal organs exposed by the wound? Is the wound just affecting the skin, or does it go through the muscle layers too? Are there structures like arteries and tendons and veins and things exposed that might need protecting? How big is the area involved? Are there other medically related symptoms that are more pressing than trying to deal with the wound, such as shock or breathing difficulty? Is the physical environment a safe place for you and the animal to be while you are working? You have to consider whether the animal will allow you to treat its wound in the field, or is it something that's likely to need sedation? Do you have adequate supplies for the situation?
All of these things need to be addressed before going on to the next steps listed here: controlling the bleeding, cleaning the wound, and bandaging if needed. So let's take a look at these steps individually. After you have evaluated the wound and are prepared to treat it, the next step is to control the bleeding. Make sure the animal is properly restrained, unlike the photo here, and muzzled if at all possible. Apply direct pressure to the wound with a clean, dry, preferably non-fibrous type of dressing. Direct pressure should be firm, but not strangulating to the tissue.
Do not disturb the clot by lifting up the dressing and peeking to see if the bleeding has stopped. If the bleeding continues and soaks through the dressing, you want to apply additional layers rather than lifting up the first layer.
If the wound is located on a limb, you can elevate the limb while you apply direct pressure to help decrease the blood flow to that area.
If that doesn't work, direct pressure and elevation are not enough and it fails to stop the bleeding, you can apply pressure to the arteries that supply blood to the area. This little diagram shows the underside of a dog or cat and shows the location of the pressure points we would use if a wound on the leg continued to bleed. On a front limb, you'd be applying pressure to the brachial artery, which is located in the armpit area of the dog. For a hind leg, the pressure is placed on the femoral artery, which is located deep in the groin area.
This slide shows the application of pressure on the femoral artery of the back leg. The dog is lying on its side with its head to the left of the slide, and the person is grabbing around the front of the thigh to apply pressure over that femoral artery deep in the groin area.
Now, you may have to hold this pressure for several minutes while having someone else continue to apply dressing and bandage materials to deal with the bleeding.
It probably goes without saying, but you need to be careful when trying to control bleeding or bandaging around a neck. Cutting off breathing is not the way to control bleeding.
In cases of large wounds like the one shown here, you may have to keep adding additional layers while getting the animal to a veterinary facility as quickly and safely as possible. A word on tourniquets. Overall, they're not used as much or not as useful as they are on humans. That being said, there are specific canine tourniquets commercially available, but one can be made just like you would for a human if any of you have had first aid before. This usually involves some type of twisting stick to be able to increase the pressure enough to occlude an artery.
Simply wrapping something tight won't necessarily stop a bleeding artery. Remember, a tourniquet is a last resort. A lot of tissue damage can occur from improper tourniquet use.
If you must use one, make sure you're applying it above the bleeding. Ideally, you want to place it directly over the artery involved, but sometimes this can be hard to find where that artery might actually be. For tourniquets that must be tied off on the top to apply that extra pressure, you want to tie it with a bow so you can get it undone easily compared to a knot. Once you've applied a tourniquet, the clock is ticking, and after the application of that, you need to release the tourniquet, hence using a bow instead of a knot, temporarily if more than 10 minutes have elapsed since the time you applied the tourniquet. This will help minimize tissue death, and it'll minimize something called reperfusion injury after blood flow is rapidly returned to an area that has had its blood flow cut off. Once the bleeding has been taken care of, or if the wound is not bleeding but still needs attention, then we want to go ahead and clean the wound as best as possible and get it as uncontaminated as we can.
Contamination will lead to infection, which severely impedes wound healing. The wound care basics include removal of all dirt and debris, cleaning the area around the wound, rinsing the wound itself, patting the area dry, not introducing anything potentially harmful into the wound, and prevention of further damage.
The general saying is, dilution is the solution to pollution.
In order to clean the wound, it is best to clip or shave the hair around the wound if possible. An animal's own hair will act as a foreign body for the animal to deal with if left inside a wound. You may need to protect the wound with lubricant while trimming or clipping the fur so it doesn't get introduced into the wound. If the wound has a lot of debris, then we would use copious amounts of clean water or saline solution to flush material out of the wound like this video shows. For cleaning, we want to use a mild soap or dilute chlorhexidine or dilute betadine solution if available. Do not use any strong soaps or hydrogen peroxide. Then pat dry with a clean, dry towel or gauze. In general, we do not want to apply any medication to the wound. Application of silver sulfadiazine cream may be in order, especially for burns. Sometimes Neosporin may be recommended. When in doubt, don't apply anything.
While hydrogen peroxide has long been used as an antiseptic, it actually can destroy healthy cells and therefore affect wound healing. While it does have some antibacterial effect, and it's great to clean blood off of things, the potential for delaying healing outweighs the benefits, so its use in open wounds is really no longer recommended. Now, once the wound is thoroughly cleaned, it's time to move on to the actual bandaging.
We'll start with why we need to bandage. As we discussed before, a bandage may be needed to limit bleeding. We may need to immobilize the wound area to limit further damage to the tissue.
They can also help prevent self-trauma in the case of an animal licking or chewing at a wound. And if a wound is properly cleaned in advance, a bandage can help decrease the contamination. The basic bandage supplies are shown in this slide here. The first layer is called the primary layer, and it's usually some type of non-stick dressing, such as these Telfa pads. The next layer is usually some type of cotton padding that comes in rolls. This is a type of secondary layer. The next layer we use is some type of thin roll gauze, and that's applied over the padding to help support and hold the padding on the limb and the wound. This is also another secondary layer. The type showed here is called cling gauze. The final layer, or the tertiary layer, is usually some type of moderately stretchy roll material, such as vet wrap. Elasticized tape is then sometimes used at the top of the bandage to help the bandage not slip down, or placed in other areas to add additional support.
Other supplies needed include medical tape and bandage scissors. It is important to provide sufficient padding to make the bandage comfortable and minimize any damage from tighter layers on top of the bandage.
The layers need to be applied evenly and snugly, but not too tight. Overall, you want to be able to fit about 1 or 2 fingers underneath the bandage to ensure that it's not too tight. It's also important to check the bandage daily for signs of any swelling above or below the bandage, and check for cold extremities. So we usually use the toes sticking out of a bandage. If those feel cold, then the bandage needs to be loosened.
Now we will go through the individual steps in applying the bandage. We usually use medical tape as stirrups to help keep the bandage from slipping down a leg. Dogs and even cats come in so many different sizes and shapes. Their leg dimensions vary much more along a limb compared to people's that we need those stirrups to help. Imagine a dachshund's back leg that is skinny at the bottom, but then gets quite wide as you go up past the knee.
Bandages on areas where the circumference varies a lot are much harder to keep from slipping down. And if the bandage slips, it causes all that material to bunch up together and potentially cause either constriction of blood flow, which can cause damage to the leg, or it might end up exposing the wound again and adding trauma to the wound by increased rubbing of the area. The use of stirrups helps decrease the bandage slipping. The medical tape is applied sticky side down on the inside and the outside of the leg, right over the fur coat. The ends can be stuck together or a tongue depressor stuck between them to hold it until it's time to finish up the stirrups. Sometimes these stirrups have to be applied on the top and the bottom of the leg instead of the sides if some type of splints are used, or maybe depending on where the location of the wound is, because you obviously don't want to stick the tape directly onto the wound.
After making sure the wound is clean and dried, a non-stick dressing is applied to completely cover the wound surface. The next layer shown here is the roll cotton soft gauze for the padding layer.
This helps pad the wound, and it may even help absorb some liquid and discharge from the wound and help stabilize the area in general.
We start wraps from the end of the limb, the distal end, and wrap upwards. We want to overlap the layer by about 1/3 to 1/2 the width of the material.
This cotton roll material is actually pretty hard to make too tight because it'll tear if you pull it too much.
Next, we apply the cling gauze in the same manner as the padding, making sure it is snug but not too tight.
And then the final layer is that vet wrap, again, making sure it's snug but not too tight or constricting. We usually try to unroll and stretch out a piece of the vet wrap and then keep wrapping that section so you're not directly pulling and unrolling at the same time. And then finally we put the elasticon on the top to help secure the bandage and maybe on the bottom to help protect the foot.
We will sometimes use duct tape to cover the foot portion to help keep moisture out. We also use plastic bags to temporarily cover the wound if an animal is going outside in the rain or on wet ground.
In general, when taping things, it's best not to go completely around the leg, so that elasticon at the top, you don't want to go all the way around the circumference of the leg or you might cut off the circulation. It also helps to make a little tiny tab at one end of the tape so that you can get it off easily.
The same bandage concepts apply to wrapping a splint, but we'll go over some of the additional things you may need to think about.
Cases where we might need to apply a splint. If there's signs of a joint, ligament, tendon, or bone injury, you're going to want to stabilize it with a splint. Some of the signs might be lameness, not using a leg, bruising or swelling, or the skin is really broken up, or the animal's in a lot of pain. Other cases we might use it if there's a visible bone sticking out of a wound, or if we want to stabilize the wound so additional motion won't make the wound bigger or make it much worse.
Some possible splint materials include pre-formed spoon splints, like the blue ones pictured here.
The drawing next to those is how they would actually look on the leg, where it's kind of scooping the leg to sit in there. They also make pre-formed splints that come in two halves and sort of surround the leg. And sometimes you can use both of those halves bandaged up or just use one half for support. But in an emergency, you can use almost any material. You can take newspaper and fold it up into many layers to make a pseudo-splint, or find a branch or a piece of wood.
Just make sure to keep the areas well padded to limit further injury to the leg.
A splint should always extend one joint above and below the injury so that motion doesn't affect the wound. Because of this, an effective splint can really only be applied to injuries that are below the elbow joint or below the knee joint on the back leg. Splints applied incorrectly or the improper size can create more trauma than no splint at all.
It is crucial to apply adequate padding underneath a splint, or the splint will rub and cause more trauma. I usually apply the padding and the initial layer of cling gauze just like a non-splint bandage, but then continue the cling gauze in another layer that incorporates the splint to help hold it in place. Bite wounds are another common first aid emergency.
And the big thing with bite wounds is that what you see on the surface is usually just a very small portion of the actual injury, as most of the critical damage is done to the underlying tissues. People are often surprised at the underlying damage when they thought the bite wounds just looked pretty minor from the outside.
The victim has often been shaken while being bit. Hair and bacteria are forced into the tooth holes, resulting in necrosis of the underlying muscle.
Such wounds need to be cleaned more from the inside out rather than just from the surface, because even small bite holes can turn into quite large wounds. This is a case of two dogs that fought with each other. The photo shows a large wound on one of the dogs, and the severity was obvious to the owner, so she brought it right in. That's the nice, clean, fresh wound we see in that photo. The second photo, the owner saw a couple puncture holes but didn't think much of it. And those, after a couple of days, turned out to be a big dying skin wound that presented, I think, about 1 week later. The unhealthy tissue in this photo, it's all pale and it has kind of that white cheesy stuff coming out, and that's certainly not as healthy as a wound as the first one. We did still manage to surgically close the wound and it healed up fine. The dogs are both from the same breed and both wounds are on the neck from the fight, so it's kind of hard to tell who's who, but they are quite different in the outcome because of the timing of the care.
Impalements. It's amazing what some animals, typically dogs, and of course labs have to be high on the list, can get themselves impaled on. The first photo is an example of a pretty dramatic impalement.
The wood post is going all the way through its body, up to holding that skin up at top. That dog actually did fine. It didn't hit anything critical, but the picture is kind of dramatic.
The basic rule is to never remove an object sticking out because removal may do more damage or start uncontrollable bleeding. If something stuck through the chest is removed, it may cause air to leak into the chest, which may cause the lung to collapse.
If it doesn't cause too much motion on the object, it may be able to cut the object closer to the skin so less is sticking out. You definitely want to leave several inches out so that it doesn't disappear into the wound. And then you want to use some bandage and bandage materials to help pad the area to stabilize the object during transport. So it can be really tempting just to pull something out. You may end up with a worse situation if you do. A healthcare facility is definitely better prepared to deal with the after effects of pulling that out.
Here's a summary of what we've covered in this video.
Control the bleeding, apply pressure, don't peek, bandage the wound, don't remove the bandage even if it's saturated with blood. Use a tourniquet only if you really have to, or occlude it by hand. You want to flush and irrigate the wound. And remember, the solution to pollution is dilution. You want to remove any large debris, dirts, rocks, and sticks. Cover the wound and bandage if needed to prevent further contamination. Use a TELF pad, and never remove an impaled object. Stabilize or immobilize it for transport, and you're good to go. Thank you for joining us for this training video.
We appreciate all of our volunteers' time
And commitment to helping out during disaster situations. If you have any questions or need more information, contact us at info@navdag.org. That's info@nvadg.org.